to talk a little bit about holistic care, which I had mentioned before, for the whole family. And it's not that other people don't want to do this or try to do this, but we're fortunately, and in great part because of our generous donors, able to truly provide both team-centered and family-centered holistic care to everyone who needs it in this dire situation. So I've talked a little bit about symptom management, pain management, psychosocial support for the child, but oftentimes, especially if it's an infant, that may really be the siblings who need more TLC and more care. So we have an expert counseling team who work with siblings of different ages in different ways to help support them and to help them come to a better understanding of what's going on with their ill sibling. One of the first questions that parents often ask is, what do I do about my other children? So that's on the top of families' minds, because they may know that the child with the illness is in good care of specialists at BC Children's Hospital and other teams, but then they're worried about, how do I work with my other kids? So our care is immediately directed towards that sibling population. The same with parents. Parents always say, I'm fine, I just have to tough this out. And the fact is, we've asked them to sign up for a marathon and they've not trained for it. And so they're thrown really into the deep end very quickly. So you can't do that without good support. You can't do that without a team. You can't do that without coaching. You think you can, but that just leads out to burnout and to other problems. Similarly, we've learned that grandparents need support. And I've always been a proponent, all of the physicians here say, if we need to talk to the grandparents or the aunts and uncles or people overseas to explain what's going on here, because they have all the questions. They're looking on the internet. They're wondering. So we can reach out with the family's permission. We've also extended that so that our bereavement groups, so we follow families in bereavement. The average time on the bereavement program is 3 years, and that's the average. So we've established a grandparent support group in addition to a parent support group and in addition to a sibling support group. So you realize how large a net surrounds each of these children just in their family. Our marvelous school teachers, our marvelous school staff have also become resources for schools around the province of BC, where a school might say, we've never had anybody in grade 4 who's on the verge of dying. How do I work with the other children in the classroom around this? And over the years, our many teachers, our current 1K, but all of her predecessors have become experts in doing support and outreach. And in fact, one of our teachers wrote the chapter in the Oxford textbook of pediatric palliative care on education in pediatric palliative care.